Hello and welcome, everyone. I am Rachel, Community Manager here at Alloy Women's Health. We are a telehealth company bringing science-backed, evidence-based menopause hormonal solutions direct to your door. I just want to make a couple of quick announcements before I introduce our guest. I want to let people know that this webinar will be shared on our YouTube channel in another day or so, and you may enjoy $20 off any purchase on myalloy.com today with the code MENOP20. Finally, I just want to invite people to drop your questions in the chat. I will turn to them in a little bit, but first I want to introduce Dr. Richa Mittal. She is a board certified internal medicine physician and is a diplomate of the, a diplomate of the American Boards of Obesity Medicine and Lifestyle Medicine. She has also completed a certificate of completion in culinary coaching from the Harvard Institute of Lifestyle Medicine, Spaulding Rehabilitation Hospital. Dr. Mittal is the founder of Radiant Health, Weight Loss, and Wellness, a membership-based practice that uses a science-based, personalized approach for medical weight management and metabolic disease prevention. Programs include medical treatment and lifestyle coaching for prevention and treatment of chronic metabolic diseases like diabetes, high blood pressure, high cholesterol, cardiovascular disease, fatty liver disease, and polycystic ovarian syndrome, to name a few, much of which we're going to get into today. Dr. Mittal is Vice President of the Dallas Obesity Society, member of the Obesity Medicine Association and the American College of Lifestyle Medicine. She resides in Frisco, Texas. Welcome to the Alloy platform, Dr. Mittal. Thank you so much for joining us.
Thank you so much for having me. I'm excited to be here and to talk about one of my favorite topics.
Excellent. So let's get started with the definition, if you will. What are we talking about when we talk about metabolic health? I feel like it's one of these terms now that's sort of on repeat. All of us say, oh, I have to worry about my metabolic health, but don't necessarily know what it means. So could you help us understand our goals and intentions on that?
Yeah, I think that's a great place to start because, like you said, this term is thrown around a lot of places. And what does it really mean? The way I think about metabolic health is it's kind of a common foundational element in all aspects of our health. And it's how a lot of foundational elements, factors come together that can help to optimize our risk or to prevent cardiovascular disease, diabetes, fatty liver, strokes, and all of these things have common foundational elements. And that's really what we're talking about when we talk about metabolic wellness, is how do we prevent these things from happening? And those small components are part of our metabolic wellness, including certain cancers.
Okay, so metabolic wellness, and I appreciate that you're using that term and not metabolic health. Metabolic wellness is sort of the bridge, if you will, to chronic disease or more health, further health, greater health.
Yeah, we kind of want to focus on what are the things that we can do to help prevent these really bad chronic things from happening. And metabolic wellness is the foundation of that.
Okay, so does it really change in menopause, or is this something largely misunderstood? Because I can tell you, and I know we're going to talk about weight and expanding waistlines, my waist is definitely bigger now than it was 10 years ago, certainly 20 years ago. But my cravings have also changed. And I know that hormonal shifts can sort of tee us up for all of that. But I also know that sometimes we may make a thing of something that isn't. So is it really, is metabolic wellness, is our metabolic standing really changing in menopause?
It is, and it's multifactorial. So there is definitely an impact of not only the fluctuation of hormones during perimenopause, and then eventually that decline that women experience after going into full-blown menopause. In addition to it's part of aging. So there's two different factors there playing a role when it comes to the changes that do occur in terms of our metabolic health.
Okay, could you tell us a little bit more about that?
Absolutely. So, with declining levels of estrogen and with fluctuations of estrogen, we know that there are certain changes that occur in women's bodies. I'm experiencing them myself. I'm sure many of your listeners are too. And one of those is the expanding waistline. And that is a redistribution of fat that occurs in the body. So there's weight gain during this time period as well. And about 1.5 pounds a year is what I've seen as the average. I've experienced more than that personally. I think that there is some weight gain, but there's also a weight redistribution that occurs during this time of life that leads to what's called more central obesity, or the waist circumference going up, which I know we're going to get into. But that is a risk factor for developing high blood pressure, insulin resistance, and cholesterol abnormalities that does impact our metabolic well-being. There's also a loss of muscle mass with advancing age called sarcopenia, and that plays a role in our metabolic rate as well as our insulin sensitivity. With fluctuations in hormones, there's impact on our sleep quality, which definitely plays a role in something that we're going to talk about today. If for women who've had mood disorders in the past, depression and anxiety can resurface during this time of life, and that plays a role in our metabolic well-being. Of course, there's other factors, but those are some of the ones that come to mind. And you mentioned cravings, right?
Mhm.
So sleep disruption, mood, stress, weight gain itself, and insulin resistance can all contribute to perhaps cravings and also maybe coping mechanisms that
Right.
may not serve us, but make us feel better in the short term.
So as I'm listening to you, I'm thinking that metabolic health is sort of like a whole system health, if you will, that includes sleep, um, mental health.
Yes.
So it's sort of like it's the relationship between all of our systems, it sounds like.
Absolutely, yes.
So, okay, so when you talked about a bit about expanding waistlines and aging, hormones, what is redistribution of weight, the effect of estrogen on all of this, and
Mhm.
sort of being teed up for metabolic syndrome? Is that the right terminology?
Yes. So let's take a moment to define what is metabolic syndrome, because that's
Okay,
what we're trying to avoid.
great.
So metabolic syndrome is basically a collection of symptoms or medical issues that if you have 3 of 5 of them, you qualify as having metabolic syndrome. And 1 in 3 adults in the United States has metabolic syndrome. So this is a very common syndrome, but it's silent. And oftentimes people recognize all the different components, but don't realize, oh my gosh, I have this syndrome and it's setting me up in life for an increased risk of cardiovascular disease, diabetes, high blood pressure, stroke, heart attack, fatty liver. And so metabolic syndrome is made up of high blood pressure, so a blood pressure read over 130 over 85, elevated cholesterol levels, so it could either be low HDL, which is a healthy cholesterol, elevated triglycerides, and high LDL cholesterol, increasing waist circumference, and this is actually has cutoffs based on ethnicity, so we don't want to just blanket say, oh, over 40 inches for men, over 36 inches for women. Those are general. But if you go down to, say, higher ethnic risk groups like Asian, South Asian, and Hispanic. Those levels are actually over 36 inches for men and over 31.5 inches for women. And then also insulin resistance. So if there's signs of diabetes, pre-diabetes, and sometimes we'll check things like insulin levels to maybe identify people or women who have polycystic ovarian syndrome or have a history of gestational diabetes. We know that they're a higher risk for underlying insulin resistance. So when you have all of these five, if you have three of them, you have metabolic syndrome.
Okay.
So that's the definition of it. The first part of your question was when this weight redistribution occurs, is it dependent on estrogen? And yes, it is. So a lot of times you'll see men who have that type of body shape where maybe they start to carry more weight in their midsection area. And during perimenopause and eventually menopause, we also undergo a weight redistribution. So the weight that we carry, say, around our hips, is not as metabolically dangerous as when we carry it in our midsection. And that's because there's an increase in a type of fat called visceral fat, which is different than subcutaneous fat.
Okay, I'm sorry to interrupt. I got excited because I was just going to ask you about that. You were leading me to think of visceral fat. Can you let us know about that? And just to repeat, weight that's typically been around our hips, thighs, is not as dangerous metabolically as weight that begins to creep up around our midsection. And can I also just sort of insert here, if you would, because I don't want people to feel afraid either, right? And all of these changes start happening. This is a normal season of life. This isn't meant to sort of put the fear of everything into us, but rather to understand. And I know that we'll get to things that we can do and focus on to make proper changes. But can you speak just a bit before that about the visceral fat part?
Yeah. So I agree with you. I think what we want to do today and in general for my objective is to empower people. And I think part of that is to know what's happening and what things we're at risk for, what things to look out for. So this means know your blood pressure, know your labs, ask your doctor about your cholesterol, have a conversation about normal values or values that are just on the border. And maybe you hear like, oh, it's not so bad. But really, these are things that if we can take into account earlier, then there are absolutely things that we can do to help prevent the progression. And it is not inevitable that if we have these things happening, if you have just an expanding waistline, but you're practicing really good health habits, you can absolutely avoid things. So that it's not a for sure thing. But visceral fat is something that I think a lot of times, requires a little bit of thoughtfulness. And when you go to your doctor's office, oftentimes they do a weight, they do a height, and they say, here's your BMI, your body mass index.
Yes.
Well, your BMI is really not saying anything about your body composition, right? You could be all muscle and have an elevated BMI. Well, are you necessarily at risk versus maybe someone like me? I'm of South Asian background. I'm at risk at a lower BMI, which is quote unquote normal. I may be missed. And so going beyond BMI to actually think about, hey, you know what? Everyone can have access to a tape measure. Check your waist circumference. And based on those guidelines that I just mentioned for those cutoffs, empower yourself with that knowledge, have a conversation with your doctor about that. Bioimpedance scales. So in my practice, we use an in-body scale that actually measures how much muscle mass, how much body fat, and how much body water we have. And so we can then target and go, oh, okay, my visceral fat is creeping up. Maybe that's something that needs to be brought to my attention and be more of a focal point. The gold standard to assess visceral fat is an MRI. Well, not many of us are going around getting MRIs, right? But there are DEXA scans available, the same type of test that we do for bone density. There are places that do DEXA scans to identify how much visceral fat we have. So part of this is like saying, hey, what are the things I'm potentially looking for? And what are my numbers? And then we can talk about what things we can do to make ourselves in a better position in terms of our metabolic risk.
Great. Thank you so much for that. I want to pivot now to just that, what we can start to do, what we should be thinking about. And something you said a moment ago made me think, this is all largely, I mean, there's more to do other than what is in the kitchen. Is that fair to say?
Absolutely.
Okay, so sorry, that just occurred to me for a moment, but you get started where we should get started.
Yeah. So, we can start in the kitchen,
Let's
but
start with
also
it.
recognize that all the other stuff actually impacts what we do in the kitchen, right?
Right.
So, when it comes to, I think, diet culture and the messaging that we get about our bodies. So I'm going to start there because I think
Okay.
as a woman, my body is changing. I bet a lot of your listeners' bodies are changing. We have to embrace that we're going to change with age, right? But we have a choice in terms of if we want to look at aging as a gift, because it's a privilege, right? Not everyone ages. It's hard to think about that. I've had to personally shift my mindset to what can I do for myself? How can I age in a way that allows me to live my life to its fullest potential, right? Whether it's family, whether it's career, whether it's my dreams to travel and whatever I want to do, right? And, thinking about when we look at our bodies and being able to embrace ourselves. And then when it comes to food rules, right? So there's a lot of like absolutes. And
Right.
when you follow a lot of, social media influencers and things, or even celebrities, doing the latest trend, it can become very overwhelming. It can become a judgmental environment. And I think sometimes we risk getting away from the basics. And so where I start with is, hey, can we empower ourselves to focus on a foundation of eating nutrient dense food, right? So we can say, hey, is there room on my plate to add something? Can we add more vegetables and fruit? If we're going to choose grains, can we do whole grains that have more fiber, including lean protein? And if you choose to eat meat, then let's focus on more lean protein and fish and poultry and minimize red meat. So far, mostly I'm talking about what to add to the plate, right? Which is kind of a nice focus.
Right.
And then last but not least, adding more fiber that helps to lower our blood pressure, lower our cholesterol, improve our blood sugar, keep us full and satiated, even showing benefits to our gut bacteria that impact all the other things outside of the kitchen that we're going to talk about. Really thinking about what to add to the plate, first of all. Secondly, when we're thinking about what things we need to minimize, maybe getting away from complete restriction, but understanding that that's not sustainable, doesn't honor our social well-being and our likes and dislikes and holidays that are coming up, but also thinking about, hey, what's sustainable for me? And maybe I can't get away with what I used to in my 20s. That's probably the case, at least it is for me. But also thinking about like, hey, this is not how I live my life every day. I know I love chips and salsa. I do not eat chips and salsa every day.
Right.
But I don't, not because I'm going to vilify myself for it, but because I want to build a foundation, So I would start there. And I know we were going to talk about other areas, but I would start there in terms of the kitchen.
No, that's so helpful. And then please go on. Where else should we be looking?
So, in terms of perimenopause and menopause changes, one of the places that I think it's very important to focus on, and as we age, is loss of muscle. And that is called sarcopenia. But what can we do about it? Well, of course, we could incorporate lean protein in our diet and we can eat more beans and tofu, but we're not going to simply eat protein and have that turn into muscle.
Right.
So, weightlifting and resistance training is a huge piece of healthy aging and healthy perimenopause and menopause care. When we build muscle, we improve our metabolism, we burn more calories at rest. I think it's empowering to work on gaining muscle. It's a exercise that helps improve your bone density, which we're at risk for losing bone mass as we age. And also, it's part of a healthy lifestyle. So when we're incorporating weight training in addition to our aerobic exercise, we live longer, we have less diabetes, and improvements in our mental well-being, which is also one of the factors we're going to talk about. Helps with mood, helps with cancer prevention. So lots of benefits to move. And I'll make one note on that is sometimes people work out to compensate for bad things that they might have eaten. But really, if we can have a broader outlook and perspective in terms of what we have to gain by moving, we can kind of dissociate the two and not really work out for compensation, but work out because we want to have our bodies age in a healthy way. And it's something we can do for ourselves.
Terrific. Thank you. Before you go on to possibly the next thing we should be focusing on, I am sort of taking all of this in and I'm thinking about my own experience and the role that HRT or MHT, menopause hormonal treatment, has played in my personal sort of metabolic wellness and weight, which has been not what I expected. And I want to hear more from you about that.
So when you look at the data around menopause and perimenopause, as I mentioned, there is a weight gain associated with this phase of life. When you look at whether MHT or menopause hormone therapy actually creates weight loss just on its own, that's variable and not per se the reason to be taking it. But there's a huge component to hormone therapy that benefits women that does impact weight, which is treatment of vasomotor symptoms. So at night when you're trying to sleep, and then all of a sudden you're having a hot flash, or you're feeling your heart race, or for me, it's been having anxiety and just waking up in the middle of the night and I'm like, I cannot get back to sleep. That sleep disruption actually really does impact your metabolic health, not only through weight gain, which is associated with it because of increase in cravings. When you don't get restorative sleep, you actually have an increase in hunger hormones that regulate hunger. You can have increases in even your insulin resistance, your blood pressure. So this is no joke. Like, not having sleep is a huge factor impacting metabolic health and weight gain. That hormone replacement can help. It can benefit women to get better sleep. Also mood. So even though per se it's not just for mood, there are studies to show that it does help improve mood in women who may be experiencing mood disorders during this time of life, whether it's depression or anxiety. And when we can get feeling better in terms of our mood, then we're able to make better decisions in terms of food, in terms of movement, in terms of sleep. So there's definitely a relationship there.
I love the points you're making, Dr. Mittal, because I think many women sort of over time, certainly in our culture, kind of piecemeal things out. So, oh, I'm gaining weight, I need to lose weight. Oh, I'm not sleeping, I need to sleep. I'm feeling depressed, I need to address that. And what you're sort of threading the needle on is the relationship that one has on the other. And it's so funny because I think back to when I started taking MHT, I really did between the hot flashes and the sleep, those were the things that I felt needed to be addressed. I didn't know how it was going to come together, and I didn't know what impact it was going to have on other aspects of my life, if you will. So I just knew I wanted to get to sleep. That was resolved. And I knew I wanted the hot flashes to go away. That was resolved. What I didn't anticipate was that actually I would be sort of like more anxious to get back in the gym. I would feel overall better, plugged in, tuned in, dialed up, and ready to sort of address what I was eating in the kitchen. I wasn't feeling so lethargic and melancholy and oh, forget it, who cares, and I'm gonna succumb to my cravings all the time. I can enjoy this and put it down. There was this snowball effect that happened that was unexpected and very exciting.
Absolutely. And then you mentioned, stress, right? We haven't really talked about
Yeah,
that too much
please.
yet. But I think that this is a unique phase of life that we go through. I mean, I guess if I look back, I go, there were always stressors, right?
Yeah.
But now maybe my bandwidth to face things a little bit limited compared to before. And then if you throw on top of that, you haven't slept enough, and now we have aging parents, and we have kids that need us. Or even if you don't, or if you're in a place in your career where there's a lot of demands, there's a lot of burnout and overwhelm. And if we can feel better in terms of our mood through MHT, that's one tool. But also maybe taking it upon ourselves to think about, what can I do for myself? And it's not about waiting for the next vacation 3 months away, or waiting for the massage that I'm going to get in a month. Or alcohol, which we have to mention here.
Yeah.
It's oftentimes a coping mechanism for women, and whether it's daily or if it's maybe having a lot of drinks on the weekend, that absolutely affects sleep, affects your cholesterol, affects your metabolic health, can lead to weight gain. It makes us feel better in the moment, but doesn't really make our mood feel better. And it's important to maybe, I call them building in pressure valve releases throughout the day. It doesn't mean that I have an hour a day, even for myself, but maybe I have just like 10 minutes, block 2 10-minute slots a day somewhere in your day to be like, let me get outside. For me, it's nature,
Yeah.
being outside, getting a change of scenery, getting some sunlight. When you do something for yourself, you're also like, I'm still a priority. And feeling like you did something for yourself is nice, especially if you stay up late at night trying to get your me time at night. I have
Right.
a lot of, I've been guilty of it too.
Yeah.
You're depriving yourself of sleep because you never came first, you came last. And therefore, now you're staying up watching something that
Right.
maybe is taking away from your sleep.
We have some great questions that have come in that I want to get to. Just before then, though, I wonder if you would explore a little further the role that alcohol plays, and particularly fatty liver.
Mm-hmm. Yeah, so, alcohol is really not a great substance for our bodies. It's a huge part of social life. And I think that at this stage of life, it's a good time to really think about, how does this serve me? Become a little introspective. Alcohol increases our risk for high cholesterol, deposition of fat within the liver. When we have increase in visceral fat, and maybe our health habits have not been quite where they need to be, if we're eating a lot of ultra processed food, maybe not getting enough, of all the stuff we just talked about, maybe there's calorie excess. That combination wreaks havoc on the liver, and fatty liver is silent. You may or may not have abnormal liver tests when you go to your doctor. But if you're having a lot of the metabolic syndrome things start to creep up, you're noticing waist circumference going up, it's a risk factor for fatty liver. And reducing alcohol, in addition to all the other reasons why that I mentioned, can be a healthy thing to do for your fatty liver and for your health. And fatty liver is reversible.
Okay.
But when you have fatty liver over time, there's some small component of people that are actually going to develop fibrosis of the liver, meaning fatty liver or non-alcoholic fatty liver disease is becoming the number one reason for needing a liver transplant. So this is important. This is something that we want to think about, even though it's silent. And again, not to sound alarmist, really all the things we're talking about today are all interlinked. So if you're doing it for one reason, you're getting extra benefits in the other department. So, having this conversation with ourselves about how does alcohol serve me, finding other ways to relieve stress and to enjoy ourselves socially is very well worth mentioning. And also, actually, for breast cancer reduction, which we just went through October, or we're wrapping up October, which was Breast Cancer Awareness Month. And I actually did a blog post about this because I felt like maybe not a lot of people know about the role that alcohol plays there.
Thank you so much for that. I'm going to turn to questions that we have now.
Yeah.
Okay, the first is, I seem to be gaining weight while using the HRT estradiol patch. Is this normal?
So, for specific questions about your medication, I'm going to refer you to your doctor. But I am going to say that, as I mentioned, HRT is really not just for weight loss, right? So, really checking in on all the other areas that we just talked about would be a great place to start. And I will mention here that, for a lot of things in our society, we talk about, well, if you have high blood pressure and it's not being controlled by lifestyle changes, we give blood pressure medicine. If somebody is going to be at risk of developing a heart attack, or maybe they have diabetes and they're doing all the lifestyle changes and things are not improving, we give them medication. And so I'm not saying that this person needs to do that, but if the trend continues and they start to develop metabolic syndrome risk factors and they're on that pathway, then despite being on HRT, it is useful to talk to your doctor or check in with your lifestyle. And lifestyle alone is not always enough in terms of being able to mitigate the weight gain. And as you mentioned in my introduction, I am board certified by the American Board of Obesity Medicine. And part of this is there's many of us now in this space who practiced evidence-based medicine, and there are medications that can help to mitigate the weight gain during this time of life if it's creating medical concerns for you.
Okay, thank you for that. Next, I heard a functional MD say that when FSH is over 25, i.e. menopausal levels of estrogen, that it's very, very difficult to lose weight. Thoughts on that? Seems to be my lived experience. I do BHRT, but last provider let me slowly slide back to high FSH, low estradiol. No wonder my weight is up. Thoughts on that?
I do. I think I'm going to revisit the thoughts that we just shared. I think when you maybe start hormone therapy, your hope is like, oh, this will be it.
No.
But I think we have to address all the other areas. And whether that's, creating a calorie deficit through eating more nutrient dense, less calorie dense foods, becoming thoughtful about our movement and our weight training and our cardiovascular exercise. Are we getting enough sleep? Are we, developing health concerns with increase of visceral fat? And am I working on my sleep? Am I coping with stress? It's not inevitable that every person is going to develop metabolic syndrome, but it is inevitable that probably most women experience some weight gain during this time. But if your trajectory continues and you're addressing all those areas, I'm going to go back to, I think that there's a huge change in the shift in your mindset of not just people in general, but physicians to start to think about whether there are, treatments that we can offer patients outside of hormone therapy during this time that are evidence-based, that have safety around them, and a discussion of the benefits versus the risks of some of these treatments that help to lower visceral fat. We don't have to get to some ideal BMI, but for this person and this individual, how can we help them optimize their body composition and so that they're not developing these risk factors. We didn't mention sleep apnea. That is a very common occurrence for women during this time. I would recommend a person get checked for sleep apnea if they're continuing to gain weight, because if they're doing everything and they're gaining weight, that's actually something that I screen for.
Okay, that's terrific to know. Thank you so much. Sleep is weighing in very heavily in this conversation. That's interesting.
Yeah.
How does HRT affect weight distribution?
So there can be some impacts in terms of loss of abdominal fat, but this is highly variable. And I think that it's important to recognize that we got to do all the other stuff too. But
Okay,
there can be improvement in visceral fat as well as improvement in cholesterol levels.
terrific. Thank you. How can loss of estrogen affect your thyroid? I had thyroiditis with super high heart rate, and taking estrogen seemed to resolve it.
So, with thyroiditis in particular, I'm actually not sure what the link is there in terms
Okay.
of estrogen drops. I will definitely look into it and I can get back to you on that.
Okay.
But a lot of times, if a person has hypothyroidism, if that's being treated, if they're, having these weight redistributions and maybe weight gain occurring, they might have changes in their thyroid hormone needs. So oftentimes with weight gain, people will require more thyroid hormone. With weight loss, they require less. So definitely getting with your doctor about that. It sounds like this person did have some impact in terms of their estrogen. The heart rate itself was probably related to that release of thyroid hormone that was occurring from the inflammation in their thyroid. But even women in general who don't have thyroiditis or thyroid hormone problems or thyroid problems themselves during this time can actually have palpitations, increase in heart rate, just associated with that autonomic nervous system activation that's occurring during this time because of the loss of estrogen.
Huh, interesting. Thank you. Is topical estrogen safe for someone with a history of forgive me, I'm not sure exactly what ER plus breast cancer? If so, what is an optimal estradiol level to prevent osteoporosis, dementia, et cetera? This is really interesting, this sort of levels of hormones, and a big, broad question, but take as much as you will.
So I would say that, in general, any woman who has had estrogen positive breast cancer is going to be someone who's at an increased risk. And I usually on this one say I defer to your oncologist and your gynecologist to really have a discussion around this. And anytime you're doing any type of treatment, you want to make sure that the benefits outweigh the risks.
Sure.
And so for you personally, there could be, maybe having cancer itself is very vague, right? So your doctor would want to take into account, how long ago was there any residual? Did you undergo chemo? Was there a mastectomy? What stage of cancer? I know that with estrogen receptor positive cancers, there is going to be a risk higher than in a person who did not have an estrogen receptor positive cancer when it comes to replacement of estrogen. And I know your question was about topical, I believe, but I really don't prescribe hormone replacement myself actually to patients. So I usually defer this for now, although I'm thinking about delving into this. So I usually defer this to your particular doctors to have that discussion.
Okay, thank you. Let's see. Thoughts on semaglutide? Am I saying that right? While on HRT for weight loss.
Well, I can talk about this all day long.
Let's do it.
So semaglutide is basically the medication name for two medications that are out there being discussed. One is called Ozempic, which is for type 2 diabetes, and Wegovy, which is an FDA-approved medication for weight management. And just a quick note on weight management, for obesity treatment, Wegovy or semaglutide is approved for, even though we're talking about BMI not being the end all be all, that's how they approve these meds, for people with a BMI over 30 or BMI over 27 with a weight-related condition. And weight-related conditions are all the ones that we talked about with
Right.
metabolic syndrome. Cholesterol, high blood pressure, sleep apnea, etc. So, or diabetes. So when we're looking at a person and deciding whether they would benefit from weight management treatment, we always want to make sure that the lifestyle is being addressed, right? Because regardless of whether you lose a pound, you have health benefits to all the different healthy habits as a foundation that we've talked about today. But if we're trying to lose visceral fat, maybe we're somebody who's at an increased risk, we're starting to see these blood work abnormalities, or maybe even functionally speaking, excess weight gain is causing knee problems or gallbladder disease or sleep apnea. There are benefits to that person to lose body weight. And absolutely, semaglutide can be a part of that treatment regimen, whether a person is on hormone replacement or not. I will mention to you that when these medicines are used, because I see a lot of people, I prescribe this medicine day in and day out, but there's been a huge upswing in the use of this medication, along with others that are out there, because of celebrities and in the news. And there's a lot of, people who are like, this is terrible. And then there's people, this is wonderful. It needs to be personalized, there's a lot of people on it who don't need to be. And there's probably more people who would benefit who are not on it. And I don't want the medication to get stigmatized. Like, there's certain celebrities who will remain nameless who said they were on it. And I'm like, And then there's certain celebrities who used it and maybe got vilified to say, oh, she used medication.
Yeah.
It's okay. Like,
Yeah.
there shouldn't be a stigma attached to using it, but it's a medication. And
Right.
there are med spas and telehealth practices that are wonderful. And then there's some who are not monitoring people well. So what I would say is that if you're someone who's considering it, go to an obesity medicine doctor who's certified by the American Board of Obesity Medicine, because that typically means, doesn't always, but typically means they're following evidence-based medicine. Secondly, supervision. When you're on these medications, it's very important to know the risks versus the benefits, things to look out for. And there is a risk of losing muscle mass because when people are on these medicines, sometimes they just don't eat. Well, that would mean that you're not on the right dose. But oftentimes people are on high doses because maybe someone just cranked them up too fast. Maybe the person themselves was like, oh, this is great. I'm losing 15, 20 pounds a month. Body composition matters, right? So we've talked today a lot about we're trying to lose body fat. We're trying to lose visceral fat. We're not trying to lose muscle. And so on really high doses of this medicine, or even on not very high doses, if it's not right for you, if you're noticing that you're on this medicine and you're not eating, that's a problem. If you're on this medicine and you're not eating adequate protein, that's a problem. If you're not working out and working to do resistance training and maintain your muscle mass, that's a problem. So I would say that being on HRT and semaglutide are totally fine, but be under the supervision of a doctor who is going to follow you for body composition and making sure that you're on the right dose and practicing all the other things that we talked about today.
Great. Thank you so much for that. That's really, really helpful. Is there a test to measure insulin resistance? I am not able to lose weight, eating healthy, like cardio, but no luck, especially midsection.
So there are some tests. Number one, your doctor can check a blood sugar. Your doctor can check a hemoglobin A1C, which is an average of blood sugar over 3 months. You can also do a glucose tolerance test. That is a good test to look at how your body responds to a sugar load and whether at 2 hours after that sugar load, the blood sugar has come down or if it's abnormal. So in my practice, sometimes I will check an insulin level with a glucose level concurrently. And there's a lot of debate about this and whether it's needed or if it's, uh, really effective in terms of being able to detect it, but it can be done. And a lot of times in research settings, this score, it's called HOMA-IR, or the insulin resistance index, can be calculated that way, and that can help to identify people. If you have a personal history of things like polycystic ovarian syndrome, if you have a strong family history of diabetes, or if you're a woman who during pregnancy had gestational diabetes, then you might have insulin resistance. If you come from ethnic backgrounds where there's a high likelihood of diabetes, right here, South Asian, Asian, Hispanic, and increasing waist circumference, you could have insulin resistance. Either way, what you're going to do in terms of your lifestyle changes might be the same, but there are certain medications, whether on label or off label, that can be used to help you in that situation.
Terrific, thank you. Let's see, how can a breast cancer ER positive, PR positive, HR negative survivor avoid and reduce menopausal midsection visceral fat accumulation due to estrogen blocking medication and the new symptoms that came with it? High cholesterol, insomnia, hot flashes, fatty liver, even without drinking. HRT is not an option in my case. This is a really good question.
It is a good question. And I have patients like that in my practice.
Mhm.
And what I'm going to say to this is that oftentimes the medications we were just talking about are a key component of that type of woman's health plan. Because when we're talking about benefits outweighing the risks, clearly in that scenario, that person is at risk of developing cardiovascular issues, diabetes. Their metabolic well-being is at risk. And, definitely if you're not already drinking, if you're already practicing health habits, it sounds like that person's saying, like, I'm doing everything.
Yeah.
There is weight gain associated with those medications and there's metabolic impacts. And so in those type of scenarios, that type of person would really benefit from consulting with an obesity medicine doctor to look at what their options were. And there's more than just semaglutide. There are other medications that we utilize. Obviously requires a medical evaluation to look at what would be beneficial and effective depending on how much maybe weight that person has to lose, what are the side effect profiles that they're looking at. So definitely there's hope in that scenario. And if the lifestyle changes alone are not working, that is sometimes the story in that situation, but there's things that we can do.
Okay, terrific. Thank you. I want to actually, before I sort of wrap up with any questions, I just want to sort of give everyone one final snapshot of what a day might look like. When patients come to see you and they're saying, I'm 53, I'm taking MHT, it's resolved my sleep issues, or it's resolved a lot, not everything. I've been putting on weight around my midsection over the last 10 years. I work out, I do all the things. I'm not obese, but my weight has been creeping up. Are you then sort of looking at labs solely and seeing if that person is indeed more than teed up for metabolic syndrome?
Yeah, absolutely. So actually one comment on what you just mentioned.
Yeah.
We can't really just comment on obesity based on body weight or BMI.
Okay.
So there are people who could have a normal BMI and never get flagged as having obesity, who might have abdominal obesity, who may have visceral fat excess. And so a better tool in that situation is actually I check waist circumference. I check how much visceral fat they have, either with a DEXA scan or with a bioimpedance scale. And yes, labs. What is their cholesterol level? What are their markers of inflammation? Do they have high blood pressure? Some of those insulin and glucose labs we just talked about. And better risk stratify a person to understand when is that, if that trajectory continues to go up, which I believe, based on what I've read, haven't experienced myself yet, is that after a person converts into menopause, that weight gain trajectory sometimes will stabilize. So that's the good news, right? But if it doesn't, and if it continues to go up, we absolutely need to be in tune with what the internal stuff looks like.
Yeah.
Because we can't just assume lack of health or having health just by external evaluation alone.
That's so helpful. And seems like a silly question, but I know it resonates with many, but what should our plate look like? You know, I mean, there are people who are going to jump on here and they just are like, just tell me what to eat. What should I eat? What should I not eat? And you painted such a good picture as to why we shouldn't sort of get caught in the it's this or it's that conversation. That being said, I know that there are people, I've been that person who says, well, I get all that, but I just want to know really what should I be eating? So could you spend a minute on that?
Absolutely. So one visual that's very helpful that you can go online and look at is called the Harvard Healthy Eating Plate, Harvard Healthy Plate. And basically, you can imagine a plate, and half of it is vegetables and some fruit. So right off the bat, again, focusing on what to add to your plate. When we eat more vegetables and fruit, we help fill up our plate, especially if we have an increase in hunger during this phase of life.
Yeah.
It helps to fill up the plate. We feel fuller. You get benefits of nutrients, micronutrients, vitamins, antioxidants that help to reduce inflammation in the body. We never really kind of touched on inflammation, but that's actually the common denominator when we're talking about the impact of increase in visceral fat, lack of sleep, inactivity. It's actually inflammation. So adding more vegetables and fruit to our plate helps in that department. Then the other side of the plate, a quarter of the plate is protein. Whether you're doing lean protein like poultry or fish, you can also incorporate beans, lentils, legumes, soy, edamame. Protein is essential to not only maintain your muscle mass at this age, but also to help with satiety and hunger and cravings.
Hmm.
And 1 gram per kilo or 0.8 to 1 gram per kilo of your weight in kilograms is a good rule of thumb there. You don't have to necessarily journal it all, but trying to make sure that you're incorporating protein on your plate and your snacks is very important. The added benefit. Oh,
sorry, Dr.
Mhm.
Mittal. We typically need more protein than we think, or like protein is a big conversation in midlife,
I know.
right? So what are we really, for the average person who isn't going to weigh their food, we really are kind of going to eyeball things. We want about a quarter of the plate every meal.
Mm-hmm. Yep.
Okay.
Quarter of your plate every meal.
Okay.
So that could be, like I said, animal-based proteins, plant proteins. It could be a combination. And then a quarter of your plate is whole grains. So, oftentimes in this day and age, there's a lot of discussion about carbs too, right?
Yes.
It's like all carbs are good, all carbs are bad. How about we pick the ones that serve us? So we want more fiber in our diet that helps to create a healthy gut microbiome, which is a whole other topic, but helps with cravings, helps lower our cholesterol, blood sugar, helps with staying full for longer. And so half the plate vegetables and fruit, quarter of your plate protein, quarter of your plate whole grains, and then fats. So we want to incorporate healthy fats, but fats matter in terms of amount. So if there is a person who's kind of like, oh gosh, I'm on this weight gain trajectory, and perhaps every time they reach for a snack, they're saying, oh, let me just have a handful of almonds, right?
Mhm.
Well, almonds are more calorie dense because they're a fat. So we want our fats to be off to the side. So you'll see on that Harvard Healthy Eating plate that there's a visual for, hey, this is our olives, our avocados, our olive oil, our healthy fats, our nuts. They're there, but they're not taking up the whole plate.
Yeah,
So I think that's a good place to start
yeah.
in terms of what to eat and maybe what that balanced plate looks like. I do want to make one note about eating late at night.
Okay.
It's not that those calories are more calories per se, but oftentimes what we may be eating at that time of day, if we're like watching television and we're kind of passively eating, is we're eating perhaps things that are ultra processed, high calorie, very indulgent, but also we may not be hungry and we're just
Right.
eating. So it's mindless. And then third of all, especially if you do have some metabolic syndrome or insulin resistance, our blood sugar does get impacted more if we're eating late at night. So we really kind of want to follow our circadian rhythms and try to wrap up our eating, further away from bedtime if possible.
Thank you so much, Dr. Mittal. We did have other questions that came in, and I do want to apologize to those people for not getting them. Some of them, I just want to say they will be addressed, just not necessarily in this call. And some of them are very specific to MHT, and I want to bring those up at another time. A pleasure to speak with you and learn from you and understand more that it's really a big, broad picture, both internally and externally. One system informs another system. Protein is important, fiber is important, sleep, stress mitigation. And if you're looking to lose weight, we didn't hover too much into it, but you did mention it a couple of times. Eating a calorie deficiency is important. And I think I got everything. Sustainability, that was a big one.
That is a big one. And, if you're struggling, get help. I think that a lot of times when you're just trying to figure it out on your own, it can be really confusing. And, that's what we're here for doctors like myself. I think a lot of times PCPs don't have time to discuss it. And there's a lot of obviously factors to this. And really whole body health is the objective. And it's been a pleasure to talk to you about this. This is a subject that I'm really passionate about just for personal reasons, because of family history. And I find it very amazing to see women transforming their lives and living their best lives and their best purpose. And so thank you for letting me share some of that with you today.
Thank you so much. Thank you to everyone who came. I do want to just remind everyone that you may enjoy $20 off any purchase on myalloy.com today using the code MENOP20, and also let you know that this recording will be up on our YouTube in another day or so. Thank you so much, Dr. Richa. Just a pleasure, enormous information, very helpful to all of us.
Awesome. Thank you. And
Thank
if you
you.
want to follow for tips and such, I'm on Instagram, Facebook at Richa Mittal MD. And you can also subscribe to my blog. It's radianthealthdallas.com. And I send out a monthly newsletter.
And it's got wonderful recipes. I can attest to this. So please, if you're looking to if you're thinking, how do I start? What do I eat? What does this look like? Subscribe.
Awesome. Thank you for having me.
Thank you so much, everyone. Bye-bye. Thanks, Dr. Mittal.